Can you hear me, Anthony?
Yeah, Dr. Stevie there.
Yes.
Can you guys hear the good doctor? Let me just everybody could hear you. So I'll start this by saying I can't thank you enough the last 2 weeks and this week for you making yourself available. Not only has he been coming on to here, but, Dr. Stevie's been texting me. And so I told him, and I want to tell him in front of everybody that to me, and I don't know if everybody shares this, but firsthand knowledge is different second and third hand knowledge and the filter through the media and everything. I want to repeat what you texted me, Doc, because I think it's important just so everybody knows that he goes, I don't want to scare people because reality is it'll affect different people in different areas very, very differently. So with that, go ahead. What are you hearing? What are you seeing?
Well, I think I'm going to start by just doing a recap on those topics we've been hitting on, and then we'll go from there.
Wait, before you start, for those that
Sure.
don't know, Dr. Steve's been with me a long time, and he's a neurosurgeon. He claims that all these great doctors, they first always prefaced, I'm not the expert in infectious disease, but I'm a doctor. I'm going to tell you what I know. And he has affiliated with 3 community hospitals in Long Island. So, all right, go ahead. Sorry, Doc.
No, thank you, Anthony. Most of what I talk about is really just basically personal experience of what we're seeing on the front lines here, and whatever reading that I'm doing related to the COVID virus from the medical journals, which I just really try to summarize what I glean from it, which I think potentially, hopefully, is somewhat helpful, somewhat interesting. In terms of the areas that we've been talking about, the testing, like we spoke about, it seems like the acuity of the testing has come up to speed. I think the next level of testing is really what they're talking about next, which is much more widespread testing, rapid testing that can occur over millions of people in order to identify who's positive and who's negative, and hopefully that will lead to a quicker restart of the economy and returning to work and those types of things. I think they are talking about weeks to months, possibly even up as long as 3 months before those tests are available. So, but I think that's kind of the next phase that we're in. I think in terms of getting tests for the critically ill and the very sick people and people that want to be tested because they have symptoms, I think that's being covered relatively well right now. But for big term screening, I don't think we're there yet. I think the big issues really here in New York, as I'm sure you've been hearing on the national news, is the lack of the PPE, the lack of the ventilators, and unfortunately, that is a real reality. I can tell you that at some of our hospitals, there really are many staff, if not all staff at some hospitals, that are not wearing PPE at all to take care of these patients. And that is just a very grim reality. It certainly isn't all the hospitals, but there are pockets of hospitals that do not have the equipment, and it's a very dangerous situation for the healthcare workers in those situations. The ventilators here have also become an issue. A couple of days ago, certainly last week, we were talking about whether we knew of any positive cases in the hospital. Over the past week, as I told Anthony, we have seen a rapid increase here, even out here in Long Island. We're not near New York City, but we are seeing a rapid increase in the number of critically ill patients. Essentially, almost all of our ICU beds, almost all of our ventilators are essentially being used. One of the hospitals yesterday needed more ventilators from outside to manage these critically ill people. So the situation is definitely not good in the sense that there are a lot of very sick patients. That being said, like Anthony had said, depends where you are in the country. It depends how you react to the virus if you are exposed to the virus. It does not mean that everyone is going to get this critically ill, but definitely some people, a proportion of people, are getting very, very sick from this virus, and it is overwhelming the capacity of the hospitals, at least here in New York. Hopefully, there are plans to create temporary hospitals, as you know, and hopefully this will ease some of it. Hopefully they will get more ventilators as time goes on. The treatments, I don't really have any major updates. The trials are ongoing for the drugs that we've spoken about, the hydroxychloroquine. It is being used off-label. I can't say that I have any real information beyond what I've spoken about before. There was some news on Friday late in the day about a study that came out of China on the use of convalescent plasma, and the FDA expanded the compassionate use of convalescent plasma for use in very sick patients with the COVID-19. What convalescent plasma essentially is the use of uh, plasma, which is a significant portion of the blood in patients that have been exposed to and have recovered from COVID-19, and then that plasma is administered to a sick patient, and the idea is that the antibodies in that blood would be able to essentially battle against the COVID-19 virus. And the study that they presented was, again, very small, limited capacity, a lot like the hydroxychloroquine study, but it was encouraging. There are some other encouraging features that have come out. The fact that the virus is felt to mutate at a very slow rate, which is typical for, I guess, coronaviruses in general, and that may be helpful in terms of long-term for coming up with a vaccine. Maybe I'll put it back to you, Anthony, and see if you have additional questions or
Yeah,
issues
I
you want
mean,
to bring up.
no, that's my first thing comes to mind is that things could change for the better or worse in 24 hours or 48 hours, right? Is that what you're saying? There's a lot of different
Right.
when you get
Yeah.
under stress at the hospital.
Right. I mean, it's hard to know where it's going to go from here. There's no question about it. I mean, some of the numbers that were presented today by Cuomo suggest that there is perhaps maybe a stabilization of the numbers in terms of I mean, number of different variables: hospitalizations, ICU beds, ventilator use. I mean, there were a number of different statistics that he showed that. Suggested that there may be some improvement slash plateau. Hard to say. Certainly, somewhat optimistic, but we'll have to see if there's either a stabilization or another leg up. I don't know.
What's the recovery rate for people that go on the vent? Do you have any idea? Like they go on the vent, how long are they on the vent?
It can be weeks to months.
Really? So it's not
Yeah.
like a day or two on it. When you go on it, you're going to be on it.
Well, it's hard to say that for everybody, but certainly people that are very critically ill, it's probably more of a week to month long process to get them off. I mean, there are certainly situations where people need some ventilatory support and they just start to get better before they get worse, and they come off the ventilator pretty quickly. But it's pretty much varied.
Is that longer than the normal flu that affects your respiratory system? Are they finding it?
Yeah, I would say so. I mean, I think this is behaving more like, like an acute respiratory distress type syndrome, some kind of massive inflammatory response of the body in the people that develop this kind of response to the virus. I think the kind of thing you're seeing in influenza is really a different pathophysiology.
Here's a good question. Are you or any of your hospitals that you know of using this plasma transfusion?
They
Yet?
are they did institute it as an option. Now that being said, it's a bit involved in the sense that there's a lot of different screening of the person that's donating the plasma as well as whoever is going to receive it. It's definitely not as simple as administering a drug because you're dealing with blood products. So there is a fairly extensive protocol that I would say limits, I would say, widespread use. So this is being used really primarily for the very, very critically ill patients, and it's it's available, it's being considered, it's being done, but it does have some logistical limitations. I'll just leave it at that.
Oh, I've seen my cousin go through it, and it's a big machine. They swap out your blood for the blood that is being right. Is that kind of like a removal?
That's right. That's right.
Yeah, I've seen that done. It's not just a little bit of blood you get. They're swapping yours out for new blood to put it. I mean, I don't mean to oversimplify it, but that's kind of what they do, or what they
That's
do.
right. That's
Okay.
correct. Yeah.
Here's a good question. Do you feel like the numbers coming out of Europe as to what's working and not working, is that is that kind of what you're citing with the plasma? A lot of this stuff is coming from what they've been doing.
This plasma study came out of Shenzhen, China. A group, a small group of doctors working out of there. So that was not out of Europe. No.
Is there good data coming out of Europe that you've read up on?
There probably is. I haven't seen. I've only seen two or three papers of any significance. The hydroxychloroquine, which is a very limited study, as you know. This study, and then the very large Wuhan study, looking at that Kaletra medication, where they really were not able to find a lot of benefit from using it for the most part, I would say. So those are kind of the bigger scientific studies, but I suspect that in time there will be a lot of studies out there.
So here's a question. They say, doctor, has your hospital run out of ventilators? Or
I would say that we're essentially pretty much there. From my understanding, is they were able to secure a few extra ventilators overnight that they needed, but they are on the verge of not having enough ventilators at one of the community hospitals. Now, what they'll do with patients, um, whether they'll transfer them somewhere else or how they'll handle that, I'm not sure. There is a surge plan at all these hospitals in place. So I do know that, unfortunately, like we spoke about, they are looking at the situation in Italy. I'm not saying it's going to get to that point, but there are discussions about how to go about rationing if that comes to be. It has not happened yet, and hopefully it will not, obviously, but
and that is
it is
deciding
being
who gets
discussed
it
about.
and who doesn't. And I don't mean to interrupt you, but is that
Correct. That's right.
those are calls and decisions that nobody would want to make, and that was a few weeks
Right.
ago that they were making there. Did you so the visions of a truck backing up with masks and PPE and ventilators is just a vision? Is that ever, could that ever happen? We ever get to a
I
point where
think it
that
still
happens?
could happen. I still think it could happen, but right now it is an issue. It is definitely an issue.
You had mentioned in a text yesterday, the next few days are very critical as to what flattening out to see what we've done the last 2 or 3 weeks has worked. It's just right. I mean, is that fair to say? Still,
That is still fair to say.
so every day, every other day is really important, and hopefully the turns come or stress is relieved. Is there any hospitals, makeshift hospitals going up around your three?
No, no, really, well, I shouldn't say that. There is some makeshift hospitals, so to speak, that they are trying to build from student dormitories at the Stony Brook University Hospital and medical school, and university there. So I think they're talking about converting some of those dorms into hospitals for the people that are not sick. But I don't believe that's up and running.
And that's Long Island. This Trade the Newswoman was talking at the same time. I missed that.
Yes,
Okay.
yes, that's Stony Brook, Long Island.
And these other makeshift hospitals, do you know of them actually? They're starting to utilize them, like the Javits Center. Is that up and running that you know of? Or
Supposedly not yet. I heard earlier this week, but I'm really not in a position to say when they'll be ready.
and so, but anything helps. There's 1,000 beds here, 500 beds here. Obviously, is
Everything is helpful. I think everything is helpful.
what would you say to people that, so you're on the ground and you know you're seeing a lot of this stuff, and so what would you tell people? Don't minimize this. Listen to what you're being told. You don't want this to happen around your city.
I think you're absolutely right about that. I think this is, again, not trying to scare anybody, but this is a real threat. I mean, I don't think that this can be minimized as, just influenza, or just something that affects older people. I think this is a highly dangerous virus to some people, and unfortunately we don't know who those people necessarily are. There's no way to screen people and know how sick they're going to get, and as a result you have to treat it as if it could affect you in the worst possible way.
If someone you knew got it and didn't have the you don't go to the hospital unless you're having breathing problems. I mean, I'm not asking you to give people your opinion, but if a patient come to you and said, I guess what I'm asking you is what their guidance is, that don't go get a test unless you have symptoms. And they have to be careful in telling people, yeah, if you got symptoms, you don't have to go to the hospital. They can't say that. But is that, I don't know how to put it, but if someone has symptoms, unless they're having trouble breathing, they shouldn't go to the hospital.
I think people's use of healthcare is pretty variable. There's a lot of
Right.
reasons why people go to a hospital. I think it's hard to control people's fears and tell them exactly what to do. I think you probably don't have to go unless you have some more serious symptoms. Elevated fever, shortness of breath. Uh, in terms of being tested. Uh,
But your
but
best bet is to talk to your doctor, obviously. Most people,
absolutely.
you got to talk. So you brought up a good point. The fever is obviously something that you got to control. If you can't, you got to be careful. It's not just shortness of breath, because those are the two of the three symptoms, right? High fever, shortness of breath, and coughing.
Correct. That's
You got
right.
to control the fever, and obviously you don't have trouble breathing. Any other questions? Just let me look in here. Do you see it says, someone just popped in. We've not already talked, or he just popped in. The fatality rates shows about 1.7% in the U.S. Does that seem about right?
I think so. I think so. The numbers in Italy and Spain seem a little bit higher. I'm not sure why. The numbers in China were a little lower. They're more in line with that 1 to 2% rate. I'm not really sure why the difference. I don't know if it's statistical, the way people, the way the testing is being done, whether there's an
Right.
actual difference in the mortality between people. Not sure.
The
Uh,
antibody test, and let's say when you kind of start plateauing and maybe on the other side of the antibody test, especially if I'm hearing like a 15-minute result that you get, shows if you had it.
Correct. Yeah.
So they'll get a good sense when this is over how many people actually had. When I say over, I mean in a few months, in 6 months, how many people actually had this.
Yes. Yes.
You didn't necessarily have to be tested and say you have it, because in 5 or 6 months, there's that test that could say, yeah, you had it. correct?
That's right. I
That's
think
how that
that's
works.
going to make a big difference. That that kind of easy widespread testing. Um,
And it'll give a better kind of clarity on the death rate and what it was
correct.
and things like that. But I think people have to understand, even if it's, I think the flu is what, 0.1 or 0.2% generally.
Right. Point one. Right.
So if it's just 1%, people can say just 1%. Well, that's 10 times the flu if it's 1%. So you got to think in those terms. Even if it's not 3%, it's 1%. Well, that's 10 times the normal flu. So I think comparing it to the flu days are over from a minimizing standpoint for people. And most people are getting beyond that. Because several weeks ago, I might have been in that camp saying, well, the flu, this, that. But that is obviously thrown out the window, especially what you're seeing.
Yeah, no question, and that's exactly it. I don't think I don't think at that time it was that unreasonable to think that way because it was an unknown.
Yeah.
Um, and they're unknowns now. So I think all in all, I think it's been a discovery process. I certainly have been surprised by many aspects of this, even though you feel like you have the best information. You're really on the front lines. You're listening to people. Uh, I mean, the amount of people that I saw this week come into the hospital really it's something I've never seen before. I mean, I've been in the medical field for 30 years, started in medical school 1989. I never saw anything like it.
Or close to it, correct?
No, no.
And I think the other ingredient is, and I'm not trying to minimize it. The other ingredient is fear, the unknown, and so it's like you got, that's a symptom they don't talk about. It's cough, it's fever, it's shortness of breath, and fear, which you know is the one that gets people to go to the hospital. And you know what? Hey, like you said, that's their own personal decision. Everybody has different reasons to go to the hospital and talk to their doctor, and the fear is a real factor. And I don't blame people for being afraid. You cannot blame people for
Uh,
being afraid,
Absolutely no.
even otherwise healthy people for being afraid. You can't, you know, you can't minimize or should I say blame. What are you being afraid? You're healthy. I don't think, you want to be cautious around every turn. But it is older people are really at risk to struggling with this if they get it.
Absolutely no
Yeah.
question about it.
And the 2 week thing is, do they generally present symptoms within a few days, or that data isn't?
They say anywhere between 3 to 14 days, approximately.
But chances are, let's say 10 days go by. If you didn't, if you don't have it, you probably aren't going to get it. They use 14 as just kind of a measure, not to be exact. Is that with any kind of exposure to, virus?
Yeah, I think it varies from infection to infection, but I think for viruses, I mean that's not an unusual 2 to 3 week uh, incubation period.
Yeah, because I've had my elderly parents that would really be in trouble if they got it locked down for 2 weeks, and their caretaker hasn't seen anyone, left the house. We don't even see them. That's been 2 weeks. And so, not that you're ever out of the woods, but you breathe a little easier that they weren't otherwise exposed to it 3 weeks ago.
Right.
Because Chicago, while it's close to being a hot spot, beyond, under or outside New York. So,
Yeah, hopefully you'll be able to mitigate it as much as possible.
well, the time is of the essence. Like when you have more time to prepare, that's just could make a night and day difference, I think.
I agree.
And it sucks that you guys in New York that were the first to get it, and then there's so many people in such a small area that it's just the way you spread something is New York and the metro area is made up for virus spread. Not that it's made up for that, but you get the point where when it's going to spread quick, it's going to spread quick in areas like that. And I don't think people understand how New York is. There's like 20 million people in your greater New York area. It's double Chicago, and Chicago's a big area. So it's a lot of people that have to be careful. Would you think though, almost going on the third week, when you've had sports teams cancel seasons and you don't have these mass gatherings, and even though some people haven't listened, many have. That's got to help, whether it's we got it in the nick of time or not. Obviously, it would have been a lot worse had we not done these things.
I would agree with that. Yeah.
But the next few days are crucial, and it's almost like I said this, or where you turn in the car and trying to keep the wheels on the ground. In Italy, almost flipped the car, but you would say New York's got two wheels on the ground.
Yeah.
I see, and ready to flip. And I'm not being insensitive. I'm just trying to make this make sense to me. And we want to keep.
And who knows? Maybe the data that Cuomo presented today is actually a positive. And
What was that again, Doctor?
he presented a number of statistics on the use of ventilators, the number of ICU beds, the number of hospitalizations, the number of discharges, and essentially they all showed, some ups and downs day to day, but it seemed like there was some kind of perhaps tailing off or stabilization in those numbers. And so I'm not, hopefully maybe, I mean, it would be nice if this is the apex,
Right, and there's still a chance for it to be.
Of course, yeah.
But I'm just I don't like to hope. I said this in another video. I think hoping is dangerous, but sometimes it's all you have. So it's a fingers crossed moment. So a lot of guys, Dr. C doesn't see your question. So a lot of guys have thanked you and says, tell the doctor, thank you. This is very valuable. This is great. This is an awesome show. And other stuff as I'm scrolling up and down. So like I said, last 2 weeks, Doc, thank you. But more importantly, stay safe and tell everybody.
You too, and to your family.
You as well.
And to everyone in the Edge Room.
No, they hear it and I'll tell them. But also let people know that are around you, other health, doctors and nurses, that you might not know it, but you're more appreciated than you could imagine, through this. I'm looking at you guys as soldiers that go to war and fight in World War II and fight for our freedoms. And especially with the lack of some of this PPE, you guys are risking your lives. So don't let them think they're underappreciated. And I know that might make a difference for some, or some others say, just get me a mask, and that's fine too. But make sure that they know that if you can.
I will.
All right, Doc.
All right. You have a good day.
You too.
All right. Be well.
Stay safe. Thanks. All right. So now what do we have? The market opening up right into 2 minutes. Now, this press briefing has been going on behind me. I told President Trump to wait till we were done. I guess they didn't get the message. So let's bring up a couple things before. I don't like getting involved in some of these gross unknowns, and so I don't just go in there swinging it. Probably we'll see. I'm not getting stuck long on a lock. Again, I don't even, where are they even indicating they're going to open? Right on lock limit? Oh, no. Sam's got 2403. I had 94, but I guess it's within the last, 5 or 15 minutes of Friday's close. So he's got 2403. 50 will be lock limit 5%. And for overnight, if it gets down there, as you guys know or should know, it stays down there. It could come off. Here we go. Actually, let me pull this off. I've got a lot cooking here on my PC here, this screen share and these dials and everything else. It looks like around 2460, which is about 30, 40, 50 points lower than Friday's close. 2520 again was Friday's close. 2520 even was Friday's close. 2403 is 5% lower, or lock limit. Ding, ding. Here's this gap you actually see. I got this on a 24 peanut. I don't want to get into a ton of what are on these charts, what is this showing you and everything else. Not that anyone's asking. Let's just, you see this gap from Friday's close around 25.20. When they open around 24.50 without being exact. What do we got? So they could fill this gap and then come off. When he was giving that press conference yesterday afternoon, and mentioned quarantine, I said it's a 5% gap open lower without question. Then they came off of that. But am I going to be surprised they crack this thing 70 handles, lock it? No. We need good news that isn't anecdotal. So Como's stats are better than they maybe could have been, but they're anecdotal because they're just 1 day, 2 days, a few days. When you guys look at, and I tell this to my wife, you look at the number, it's almost like, don't show me what happened yet day over day. Give me a 3 day. You know, we're plus 200, plus 500, plus 2,000. Like Illinois was plus 400, plus 1,000 in the last 2 days. So they've more than doubled in the state, not in the city, but in the state. So we're not getting, we're in the screech too, as far as trying to put your head around this. Italy, unfortunately, to no fault of their own, you know, they flipped the car and their healthcare is where it was. And we've got 2 wheels off the ground in New York. And so I don't even like people in New York, but I'll tell you what, I do now. And when I say I don't like people in New York, it's a Chicago, New York thing, but they're Americans, and people in Italy are people. So it's like, unfortunately, something like this brings us together. But if it doesn't, there's holes in your head. I was just in New York a few weeks ago, and I wish nothing but the best. And I think that they're tough. It's a tough city. You're from New York. When I say, you know, I don't like New Yorkers, that's just being lighthearted and joking. But there's a lot of tough SOBs, and if any city could handle it, it's that city. This press briefing is just a lot of, I don't hear any new news being made. It's just a lot of the same. The damn vision I have of trucks backing up to hospitals, it'd be nice to hear that beeping sound with ventilators and masks and reduce fear of people. Man, I don't want to see people having to make the decision of who gets a ventilator and who doesn't. What are we doing here? We're doing, look at this. Take a look at this 24. This puts it in perspective. We open up way below the 50, 60 below Friday's close, and they're just trying to scramble higher. I'm going to say what I've been saying over the last few weeks. When you open up a lot lower, this doesn't necessarily make a difference for the next half hour, but when you open up a lot lower, at some point it's not cheap and you can't find buyers. You're not going to find buyers. There's finding buyers in here, and they'll scramble up, and you'll see what they do on the 20 area. Just, you got to be careful you click the mouse in an overnight session like the last 3 Sundays, because there's not a lot of structure. There's a lot of ton of unknown that's trying to get worked out in the whole price discovery process. When you get in tomorrow morning, there's overnight information, there's overnight news, and there's a little bit of structure almost where you can lean on a little bit more. Whereas when you come in from a Sunday, from Friday, with all this uncertainty, it's like, well, if you're going to open up 5% lower, I have no idea. Trump mentioned in this press briefing the combo drug with the Z-Pack and the malaria drug being tested on 1,100 people in New York, testing has increased, which is why the U.S. or overall testing has increased, which is why the U.S. has. I don't care if the U.S. has the most cases or not. I care about flattening this thing out. That's what I care about. To worry later about who has more, could we add less? That's for future reform if this ever happens again. Right now, it's not the problem, it's the solution right now. You think so, Bruce? He went to, what med school did you go to? I'm just joking. I could say that to Bruce. I know him well enough. Bruce was a minor league baseball player with Cal Ripken in the Baltimore organization. How long did you play with Cal Ripken? He took your spot, didn't he? 2 years. No kidding. Was he a real hard-working guy? He must have been crazy with that, with all the games he played. I remember reading in the Sports Illustrated in 1989 or 1990 that if he was going to break Lou Gehrig's record, it would be in June of 1995. I'm like, oh my goodness. And then it was actually past that because they went on strike, so they missed games. That was like 5 or 6 years before he broke it. Bruce says, very hardworking, very nice guy. The whole purpose of today was, firsthand info to me is like much more valuable than news info. And as far as like trading this, the best advice I can give you is you got to manage your risk first. Trading 9/11, 08, all this stuff that I've traded, all this volatility, this is different in the sense that it's hard to explain. I'll put together a webinar when I'm going to talk to a couple guys, prop trader friends of mine, and kind of put it into words how this is different than past uncertainty. Well, I could tell you this. Thanks, Peter. That 24, I might have said it wrong, but 2403 half, about 85 points below us is 5%. 2403 half. We've opened up and grinded higher. It's hard to put it into words as to why it's different. And over time, I will be able to do that. I'll tell you this, though. I wasn't the different, you almost live in the uncertainty. With 9/11, we weren't living the uncertainty. We weren't in New York. And we weren't living that in 08. Meaning there was no, what's the word? I was in a good position financially in a way. I had no worries about what was going on around me, and there was opportunity in trading, so there was no fear with that. And with Greece, and then with the debt crisis, it was all welcomed volatility. This is like there's a psychological point of it where everybody is could be a target. Everybody's a target. I'm sure you guys feel that way too. You don't want to be scared, but you don't want to be fearless. You gotta balance it. So 25.20, guys, where we closed on Friday. So this whole gap close and fill this gap and everything else. Could you sell it up there? Manage your risk, take a shot, but it doesn't just go to 20. When it works, it goes underneath 20 and then comes off, and you're like, well, I didn't get it. So a lot of people miss selling the gap. Me, a lot of the gap stuff was when markets were like they are now every day. Every day there was a true gap because they weren't open overnight. So it was like Friday to Sunday. This is a true gap. We didn't trade in here from one day to the next. He's going to extend these guidelines 2 more weeks. I don't think that's a surprise, but the market did get hit a little bit, I think, from it. But overall, I don't think that that's a surprise. I don't think the market was hoping people are going to get back to work, so to speak. Let's bring up some of this other stuff. You got oils down over 5%, almost 6%. You got the bond market that's up, as you would expect. You've got all the equities down almost 1.5% to 2%. Oil taking a beating around 20.93. No, that was the open. There's a crude oil dial. 2025 gets you a barrel. I went to the gas station and told the guy, let's go, get the ladder, lower the price. And he said, sir, we don't use ladders anymore. We got it digital. I said, well, give me the board. 65 cents a gallon. And if you could prove you're a doctor, nurse, or a healthcare worker, you get it for free. I seen a nurse or a doctor at the gas station. I pay for their gas, but they have to stay away from me. Unless it was a nurse. I'm just joking. Don't get me in trouble, Sam, by laughing at my jokes. People who don't know me are like, who is this guy? So nice and professional with the doctor, and then he leaves talking about nurses and gas station. Forcing the clerk to change the price with a ladder. I'm not going to stay open too much longer. Hopefully you guys got the gist of what's going on in New York. And he really framed it really well, because it's to me, I think it's worse than I thought, talking to him, texting him Saturday, with a chance to, like the upside down V. How do you do that? How do you do that right there? And it's these makeshift hospitals. It's these trucks of ventilators, and man, it's the relief to hospitals. The help is on the way. All right, Gianni, have a good night. I don't mean to, looking at charts most of my life. It's the, I hate to say this because you're taking life and cases of people sick, but there's that capitulation that you get. And there's so much that we, like, how many tests are done? Like if you did 10,000 tests today, you're going to, in 5,000 cases or tests yesterday, you're going to have more in 3 days whenever the, results come back. So there's so much like lag. Some tests take 3 days, some 5, right? It's not like you do the test, okay, here's the data. It's all lagging. So what's really important to follow is what, like Dr. Steve said, what these New York hospitals are going through. 30 years, you've never seen it. It's almost like that movie, The Outbreak, where the hospital is just flooded with people and they're scared, and they should be scared. And hopefully they're calmed down by people who are good at doing that. So for Edge Room guys, we'll see you tomorrow. Careful trading this thing. Don't be a hero. There'll be opportunity, and anticipate some headlines, and we'll prepare for that. See what happened overnight. 25-20s yesterday's, Friday's close. Is it going to go there perfectly and come off? Oh, that's great. Could have sold it. Generally, when that works, it goes a little above it or below it. Doesn't let people too good to be true to go, too close to it, then come off. But don't be a hero. It's illiquid, so you get this grind up, this move lower, this grind back up. You just gotta think of what could be positive, and do we get it? What could be negative, and do we get it? Right? Markets will rally at least short term. We can anticipate what's positive, and we get it. We'll do that every day, but including tomorrow at 8 when we reopen the trading room. You guys that I'm not giving out a free trial to the room like I have the last couple weeks, but those that want to join it, just go to the website, look into it.